Welcome. Today we're diving deep into a rare and often misunderstood neurological disorder, autoimmune stiff person syndrome, or SPS. The exact cause of stiff person syndrome remains elusive, but the prevailing theory points to it being an autoimmune disorder. This means the body's immune system, normally designed to protect against foreign invaders, mistakenly attacks its own nerve cells in the brain and spinal cord. Specifically, it's often linked to antibodies against glutamic acid decarboxylase, or GAD, an enzyme crucial for producing GABA, a neurotransmitter that inhibits neuronal activity. The pathophysiology of SPS centers around the deficiency of GABA. GABA acts as a brake on nerve activity. When GAD is attacked, GABA production is impaired. This leads to overactivity of motor neurons, resulting in muscle stiffness and spasms. The antibodies, particularly anti-GAD antibodies, disrupt the normal inhibitory pathways in the central nervous system. Other antibodies targeting proteins like amphiphysin, gefferin, and DPPX can also be implicated, leading to varying clinical presentations and disease mechanisms. SPS is remarkably rare, affecting an estimated 1 to 2 people per million. It can occur at any age, but is most frequently diagnosed between the ages of 30 and 60. Women are affected approximately twice as often as men. Because of its rarity and varied symptoms, diagnosis is often delayed, sometimes by several years. The hallmark symptom of SPS is progressive muscle stiffness, primarily affecting the trunk and abdomen. This stiffness can fluctuate but often worsens over time. Episodes of painful muscle spasms, triggered by sudden noise, touch, or emotional distress, are also common. These spasms can be severe, leading to falls and injuries. Other symptoms may include an exaggerated startle response, anxiety, and agoraphobia due to the fear of triggering spasms in public. Diagnosing SPS can be challenging due to its rarity and the variability of symptoms. Diagnosis typically involves a combination of clinical evaluation, neurological examination, and laboratory testing. Blood tests to detect anti-GAD antibodies are crucial, although not everyone with SPS tests positive. Electromyography, or EMG, which measures electrical activity in muscles, can reveal continuous muscle activity even at rest, confirming the diagnosis. Other tests may be performed to rule out other conditions with similar symptoms, such as multiple sclerosis or Parkinson's disease. While there isn't a universally accepted classification, SPS can be broadly categorized based on the presence of specific antibodies and the predominant symptoms. Classic SPS primarily involves trunk and limb stiffness, and GAD antibodies are frequently detected. Variant forms such as PRMS, progressive encephalomyelitis with rigidity and myoclonus, and stiff limb syndrome may present with additional neurological features and different antibody profiles. Currently, there is no cure for stiff person syndrome, so treatment focuses on managing symptoms and improving quality of life. This often involves a combination of medications, including GABA-enhancing agents like benzodiazepines and baclofen, to reduce stiffness and spasms. Immunotherapies such as intravenous immunoglobulin, or IVEG, and plasma exchange are used to reduce the immune system's attack on the nervous system. Physical therapy and exercise are important to maintain muscle strength and flexibility. Pain management strategies, including medications and alternative therapies, may also be needed. Unfortunately, there are no known preventative measures for stiff person syndrome, given its autoimmune etiology. Since the initiating event that triggers the autoimmune response is still unknown, preventative strategies are not yet possible. The prognosis for individuals with SPS varies. The condition is generally progressive, but the rate of progression can differ significantly from person to person. With appropriate treatment and management, many individuals can lead relatively stable and productive lives, although they may experience ongoing challenges with stiffness, spasms, and pain. Recent research is focusing on identifying novel autoantibodies associated with SPS and developing more targeted immunotherapies. Clinical trials are exploring the use of stem cell transplantation and other advanced treatments to potentially halt or reverse the autoimmune process. Further research is crucial to improving our understanding of SPS and developing more effective treatments.